I've travelled 12,000 kilometres across the world to Abu Dhabi after a special invitation to work in an extraordinary vet hospital. The animal they treat here is also extraordinary, the falcon. Falcons, they're not just birds. They have their own passports. They can fly internationally in the cabin of the aircraft with their owners. So you can imagine that if they get sick, they get treated like royalty. And that royalty treatment happens right here. Have a look at these guys. It's amazing. How are you?
Hi, how are you?
Good, I'm Chris from Australia, here to see Dr. Margaret.
Yeah, okay, I'll take it for you.
Thank you. This is the weirdest waiting room I've ever seen. Hello.
Hi.
How are you?
Nice to meet you.
Lovely to meet you.
How are you doing?
A couple of your patients waiting here?
Oh, definitely, yes. They're just waiting for the checkup now.
A world away from Bondi, Chris is meeting hospital director, Dr. Margit Muller.
I'm not jumping the queue, am I?
No, you're always welcome to jump the queue, of course.
I walk in and straight away realise this place is like nothing I've ever seen before. It's a vet hospital totally devoted to an animal that means a lot to me. I have two favourite birds, pelican and the peregrine falcon. I want to know though, for you, as a vet, you could have worked with any animal. What is it about falcons that captivates you?
Falcons are fascinating. It's not just a bird, it's an individual character, it's a real personality. And the more you work with falcons, the more you learn. I mean, I'm working with falcons now since 16 years, but still I'm learning. And that's fascinating with falcons. It's just a beautiful bird. You look in their eyes and they're captivating you. And that's actually what happened to me. So it's like a virus. It's catching you and it never lets you go. Every year, Margit and her team treat over 9,000 sick and injured falcons. That is a lot of birds. The first feather of the wing is broken, which means that's causing her really problems to fly. And at the same time, if the new feather would grow, she would not have any hold.
So it means she's not flying straight and level?
See here?
Oh,
so
wow.
this is missing. The first one is missing. Okay. And that's an important one. The sad fact is, a falcon would find it incredibly hard to survive in the wild with an injured wing. Good. This girl needs immediate surgery if she's a chance of having that wing repaired. The need here is that she can't go back out and be a normal falcon until she has perfectly balanced wings and can fly normally. Yes. Because if one feather breaks, then the next one could break and then it could just go down, and this will cause her really a major problem.
What happened?
Left them somewhere. Attacked by a dog.
Okay. Let's have a listen.
Back in Australia at the Bondi Referral Hospital Sash, emergency vet Dr. Lisa Chimes is urgently assessing a badly injured Burmese cat.
Coco has been rushed in. She's been mauled by a dog. She's got serious injuries. She's in shock and she needs emergency care right away.
Just give you a little prick now, sweetie pie. Okay, darling.
Distressed owners Tracy and Vance found the traumatised cat just moments after the shocking attack.
She was cowering in the next door neighbour's yard and just howling. I went over and tried to pick her up, but just she wouldn't let me near it. It was a horrible, horrible thing to see.
All right, darling. Oh, there are some bite wounds over there.
Yeah. Coco's really been beaten up. She's having breathing difficulty. We're giving her oxygen, trying to place an IV catheter, and I need to take a better look at those wounds to see how bad the damage is.
Good girl, Coco. I'm just clipping off Coco's hair at the moment to try and work out where these wounds are. The concern is that what I'm seeing on the skin is really just the tip of the iceberg. If Coco's got serious injuries underneath these skin wounds, her life is in jeopardy.
Would she have broken that feather just through a flying accident?
Yes, that's usually how they do it, yes. When they fly or when they hit a prey or they chase a prey and they hit, then they break the feathers.
At the state-of-the-art Falcon Hospital in Abu Dhabi, Chris and Dr. Margit Muller are about to begin delicate wing surgery.
She's the Ferrari of the bird world, isn't she?
She is, but in the same time, when you look at her like this, she looks like she has a big body. But when you open up the wingspan, you can see that the body is actually quite small compared to the wingspan. We have some falcons that have a wingspan up to 1.2 or 1.3 meters, so it's really huge.
And is
So
this
it shows the difference.
problem here?
Yes.
Yeah, so she's missing...
Yeah, she's missing this part. This is the first primary, yes.
Primary flight feathers are called that because they are the most important feathers a bird has. They take most of the force and give them most of the lift they need to get up into the air. Without them, they can't fly efficiently or safely.
And in order to fix the feathers, we have some spare parts.
Did I hear that right? Spare parts. Oh, wow.
We have thousands of feathers for the left wing, right wing, tail feather, first feather, second, third, for all the different species and for all the different genders.
When you're dealing with the Ferrari of the bird world, it makes sense that you might have to go to the mechanic for a bit of a tune-up. Well, Margit, as a specialist Falcon doctor, is that mechanic. And naturally, she has a very special spare parts drawer.
This is feather number 1. It's a very slim, a very small one, and this is the one that we have to repair. Feather number 2 is a little bit slim here, but here it gets a little bulky, and number 3 is quite a bulky one. If you put a wrong feather or one which is too large, the bird has again problems to balance, so it's useless what you do. So you must do a perfect match.
So that one's shorter, so you're trying to get the same
Yes.
thing here?
See? And this one, it is still a little bit too long.
Yeah.
So it has to be shortened up to here, actually, okay? This is artwork.
That's great. I'll check it again.
Yep.
So even though this is a state-of-the-art vet hospital, not everything is high-tech.
Now that's a stick for barbecue. You will put your meat and prawn and vegetable on it. It's a skewer. And we put feathers on them because it's bamboo. It's lightweighted, it's elastic, you can move it, you can see.
Yeah.
It's the perfect material to fix feathers on them. So we are skewering the feathers on them, actually.
So the Ferrari has a skewer inside it.
Exactly.
I've never been a Ferrari mechanic, but I'm about to become a bird Ferrari mechanic.
Together, and then you mix. Yeah. Now you put it inside the shaft.
Sometimes the most seemingly simple things are actually the hardest to do. We're talking about a skewer and a bit of glue here, but I'm sweating. This just has to be so precise, and the pressure's on.
You put this feather inside the shaft, okay? And try to make a nice alignment. Okay, and here we go.
It's intense there, isn't it? You have to get it right.
It is, it is.
Chris and Margit now have to wait for the bird to wake up before they'll know if the surgery has been a success.
You have to get it 100% right. 99% is not good enough for a falcon.
All right, darling.
It's okay.
She's really been munched here. Look at these wounds.
At Sash, dog attack victim Coco is in serious trouble.
All right, honey. Okay, sweetie pie.
Lisa is urgently trying to find out just how badly she's been mauled.
It really worries me when a 5-kilo cat like Coco has been attacked by a big dog. Bite wounds not only cause tissue damage by tearing and shredding the skin and muscles, but they also inject bacteria which can have life-threatening complications. Oh, darling. This dog has really got into Coco. There's a lot of dead space under the skin, a lot of areas for infection to spread, so trying to flush out as much as possible. He's really had a good go at her. Oh,
Suddenly, Coco's condition starts to deteriorate.
You want some oxygen for him?
yeah, put a mask on him. He's really breathing up. What we're going to do now is get Coco into the oxygen cage so she can stabilise a little bit more because she's having some breathing difficulty. Now that might simply be because she's in shock, but it might also mean that she's got some injuries in her chest from the bite wounds.
You're really struggling, aren't you, sweetie? You just breathe in that oxygen.
Coco's devoted owners have been anxiously waiting for any news about their critically injured little girl.
So we've clipped up all the hair over her rump and she's got lots of bite marks there. The problem with that is we don't actually know what damage they've done underneath. So Best thing to do for her would be to take some x-rays of her and see what's going on in her abdomen and any obvious bony abnormalities. And
Can we see her?
yeah, absolutely. Tracy and Vance are in a little bit of shock. Their beloved cat has just been mauled by a dog, and now I'm here telling them that her life could be in jeopardy. And that's just a lot to take in.
Okay, so here she is.
Open it up.
Hello, baby. My princess. You had a tough day.
It's really hard to say goodbye because I don't know what's going to happen to her. I don't know whether she's going to be okay. It's very tough.
We'll look after her. All right, I promise she's in very good hands here, but I can't really give you any guarantees until we know exactly what she's done to herself.
Okay, so
Seeing Tracy and Vance visit Coco in the oxygen cage and watching them with her made me really sad.
thanks, Lisa. Thank you.
They absolutely love their cat, and if I can't get her back to them, it's going to break my heart as well.
Once they wake up, they're fully clear. They're not dizzy.
Just wake up so quickly, don't they?
It's much faster than dogs or cats.
In Abu Dhabi, it's an anxious wait for Chris and the team to see if they've managed to successfully repair an injured falcon's wing.
Just testing out the new equipment. This is amazing. That was something else. Fixing a Ferrari with a 1 cent barbecue skewer. But now the biggest test will be to see if it works.
It's exciting here, isn't
She was having a closer look.
Yes, definitely.
There's something very unique about this entire experience. You've got a vet clinic that is solely focused on falcons. You've got a woman in Margate who's devoted her life to treating them. This is something I'll never forget.
Sometimes when you look in their eyes, you know they're saying, okay, try to help me or do something, even if it's a hopeless case. And then you try whatever you can do, and normally it works out well, yes.
Well, I think you're doing more than just a little bit for them. You're doing a lot for them.
They are my passion, yes.
All right, darling, that's okay. All right, kitty kid.
Back at Sash, little Coco is fighting for her life after being savagely mauled by a dog.
What a good girl. We're about to take some x-rays of Coco. We don't know the extent of her injuries, and looking at these pictures will give me a lot more indication as to how bad the damage is.
Lisa is worried the little Burmese may need surgery on her shocking bite wounds.
Okay, so I'm looking at her chest. As I'm looking at the x-rays, I'm focusing on different parts of her body to see if this dog's teeth have done some serious damage. So I'm looking for any fractures, any broken bones. My goodness, this is amazing. I just can't believe this. This is not what I was expecting. Coco is only 5 kilograms, and as I'm looking at her x-rays, I just can't believe that she hasn't got any broken bones and that her abdomen and chest are looking okay for now. It's quite amazing.
But the little cat isn't out of danger yet. Lisa needs to find out if any of her organs have been damaged or if she has internal bleeding.
So we're just doing an emergency ultrasound on Coco, trying to look for any areas where she's had trauma. So any sign of fluid in the abdomen, which might indicate bleeding or rupture of an organ. So her bladder looks fine, kidneys look fine, no sign of fluid anywhere. Coco's passed all the tests for now, but she still has some pretty nasty skin wounds. They can become infected, and that can quickly be fatal.
Lisa's urgent priority now is to keep Coco's wounds stabilised and stop the spread of infection. The next 12 hours will be critical.
She's nowhere near out of the woods yet. I just hope, for Coco's sake and her family's, that we can get her through it. That's a girl.
All right.
So we've got all our gear. I think that Bill and myself will be primary gator catchers.
At the Australian Reptile Park, irate alligators are jostling for territory rights, and it's getting ugly.
Most of the problems are happening because we've got some younger males that are now full size. They're big boys, and they're trying to overthrow the older males. Now, that can end in some pretty serious injuries and potentially death. Remember, these big boys, they're a few hundred kilos. If they roll on your legs under, it's going to snap, so keep it out of the way. OK, let's do it.
The keepers need to be able to identify the troublemakers. But the problem is, in the water, all the alligators look the same.
The plan is to catch them and put a white mark on each of their tails. And we'll mark the scales in different patterns. And when they swim, their tail sits proud in the water and we can observe who's doing what.
Tim needs extra helping hands, so park builder Dan is about to get an impromptu lesson in alligator safety.
All of these females need to go back in the water, but we'll just do Gator 101. The fact is, even though Dan's a builder, he needs some experience in this area. Everyone does, because he doesn't need to know how to catch a gator, but he needs to know how to respond if there's an emergency. Tap on here. That's it. Well done, mate. You can use a little bit of force on the nose, OK? And that'll stop him.
You certainly don't get to jump on gators when you're building, that's for sure.
But you have to know, once we start this and they think it's feed time, they're going to come 3 times faster. Come on. Come on. Come on, bit more, up.
The first alligator to be lured out is big, and he's angry.
Righto. No surprise who it is. It's Mr. Skinny. He's the oldest and historical dominant gator. Maybe not that case anymore. Good. OK, up, boys. Dan on the rope. Come this side. Mike, you protect us. Oh, a bit more. OK, Mike on with me. Obi, watch water. This is a really dangerous situation. OK, we're going to take him to that tree. We've got 40 gators, and most of them think it's feed time. So they have one of the strongest jaw pressures on Earth, and we've got the biggest of the big here. You want a hand? We need to have our wits about us and just be ready for anything to happen. Geez, they're coming in thick and fast.
Hey, Coco. How are you feeling?
At Sash, it's been an anxious night for Lisa and the team, monitoring traumatised bite victim Coco.
When I look at those wounds, I'm concerned about them. They're swollen, they're painful, and I'm worried that if we don't take her to surgery, that they'll break down, become infected, and that could put Coco's life in jeopardy.
Tracy.
Hi, come through.
Thank you.
Waiting has been agonising for Coco's distressed owner, Tracy. Now, Lisa has to deliver some bad news.
So, the wounds, remember I said it was a possibility that they're not going to drain very well? Well, today that's our concern, and the best thing we can do for that would be to actually do a surgical procedure where we open up that skin, really debride out all the dead tissue, all the damaged muscle under there, and put some drains in. If we are proactive and do it early, then she's got a much better chance of recovery and a much reduced chance of complications.
Okay, yeah, I think, yeah.
I'm sorry.
No, that's okay. Actually, I was hoping for better news today. When I heard the word surgery, you know, I started crying because I think I had an expectation that she'd just have a few days here. It's a worrying time. That's what I'll spend the day doing now, worrying about her.
Hey Jess, this is Coco. Just having debridement of her dog bite wounds. So they're pretty nasty. Poor Coco. I mean, it's not bad enough that she was attacked by a vicious dog yesterday. And now she has to go under the knife to have those wounds attended to. This poor cat is 13 years old and in the last 24 hours has probably been through more than she has in her whole life.
Surgeon Ricky Cashmore is performing the operation.
So we'll just open this up and we'll have a look underneath and see what damage has been done. Look at that.
All right through into the muscle.
It does go down through the spinal muscles, right down onto the vertebrae, and it also reaches to the pelvis as well. So it's a pretty deep and nasty injury. She's in a very dangerous situation.
Yeah.
Let's keep him back.
At the Australian Reptile Park, cranky alligators are getting a little too close for comfort.
Oh, listen to that. The plan is to catch the big gators. And when we get them up close, we can individually identify most of them. But what we need to be able to do is identify them in the water when they're swimming around and causing problems. Start from the top, hey?
Yep.
Now, the only way to do that is to mark them, and then we'll be able to observe from a distance and find out who the trouble causers are. But they're all coming in. We have to be really aware because this situation can go bad really quick. Right, Mike? You're right, you go. But well, let's get number 2. Here he comes. Over here, fellas, we might catch him here, hey?
Gator number 2 is huge, with an appetite to match.
Good. Okay, right, come bring him this way, swing this way. Watch him for roll. Again. This is one of the teenagers, and arguably the biggest gator in the lagoon. So we'll mark him now. The boys have decided we'll call him Stonker, and we get to watch him over the next few weeks.
Stonker doesn't want a paint job, and he's letting the team know it.
Just be ready, Dan. He can go anytime. Okay.
He's sucking in the big breaths, and that means he's getting his energy back. Okay, everyone on. He's going again, he's going again.
Just remember, you're just going to have to hold him still so he doesn't freak out, but I've got his little treats anyway for him.
17-year-old Declan and mum Carol Ann have arrived at the Bondi Clinic with their brand new cavoodle pup, Cujo.
Hi, how are you? This is little Cujo for his next injection.
He's been good?
He's been very good.
He has become my best friend very quickly, and he'll be my best friend for a long time. Hello.
Cujo is Declan's much-loved companion dog.
Declan has cystic fibrosis and he's been very, very sick his whole life. His doctor actually recommended a puppy dog for him to help him have a best friend, four-legged friend. You know, that's there every day, that wants to kiss him every morning and cuddle him, and it's made him a lot happier. It's given him a new lease on life. He loves him the moment he saw him, so it's awesome.
Hello.
Hi,
how are you? Now, is this Cujo?
This is Cujo.
Need that black fur somewhere? Yeah.
Hardly see him, he's getting so long.
All right, come on through.
Chris has arrived back from Abu Dhabi just in time to give Cujo a vaccination and an all-important health check.
I'm hoping he passes his health check so we can go to the park. He can come to the hospital with me, maybe even go to the farm, something, everything really.
How long have you had Cujo for?
About 5 weeks.
5 weeks, yeah. Oh, quick on the tongue.
Oh, yes. He loves lick. He licks. Well, we say they're kisses.
They're French kisses.
Yes.
If they're kisses, they're really...
All over Declan's face. I'm like, oh, Declan.
It turns out this is more than just a health check for Cujo. This is actually a check to make sure that Cujo is healthy enough and protected enough to be able to go into a human hospital with Declan and keep him company while he undergoes treatment for cystic fibrosis. How's he been around home? Has he been nice and healthy and you haven't noticed any problems?
No.
Even though the risk of transfer of any disease between pets and people is incredibly small, the fact is, if Cujo isn't healthy on this health check, I can't pass him as being okay to go to the hospital. The outcome of that would just be devastating.
It's actually onto its pelvis as well.
Yeah.
At Sash, life-saving surgery is underway on little dog bite victim Coco.
You can see that that tooth mark in the skin was just the tip of the iceberg. The tooth has actually gone right down into the muscles surrounding the spine.
The depth of the dog bite injuries on Coco's body is far worse than expected.
We're right down between the muscles of that left hind leg. So it's split down to the pelvis on this side too. Yeah, the biggest risk for Coco is going to be infection.
It's hoped that deep flushing will help remove any bacteria that may have come from the dog's teeth.
What we've done here today will minimise the chance of infection, but still, she's in a very dangerous situation.
Yeah. Seeing the extent of these injuries, I can only imagine how terrified she would have been when that dog pounced on her and mauled her.
Well, I'm pretty happy now. I think that's pretty clean. I'm comfortable that we can close her up. We've got these 2 drains in place that are going to continue draining the fluid from beneath the skin, and we'll wait and see how she recovers.
Come on, Coco, you've got to wake up now, honey. Every animal recovers from anaesthetics differently. Some sit up right away and others take a long time to wake up, like Coco. She's an older cat, she's cold, she's got lots of factors delaying her recovery. Hopefully she pulls through this, because this little cat does not need another disaster.
There's a breath. Yeah, it's moving a bit more. It's coming around now. There you go, that's better.
Coco has finally recovered from the anaesthetic, and right now she's conscious, she's groggy on pain relief, but at least she's still with us.
Coco will have to be closely monitored around the clock to make sure there are no signs of deterioration.
You've been through so much, sweetheart. That's a brave girl.
Is Sonny getting taken out? That's him not too happy with it.
At the Australian Reptile Park, angry alligator Stonker has been marked and is ready for release.
So when it's time to jump off, we've got to do it swiftly and get out of the way, because we don't want to get smashed by his tail, we don't want to get smashed by his jaws.
Okay, Dan up. Yep, right to go. Mike, back. 1, 2, 3. We've all jumped. Everyone's waiting for something to happen. 3. And Stonker just sits there. He starts to head back to the water and we pop the blindfold off. Job done.
2 adult males have now had their tails painted, so they'll be easier to identify.
Okay, well, that's 2. Let's get number 3. That's it. Watch, Bill. Righto, we're on.
Tim and the team suspect at least 2 more alligators need to be singled out. But all the commotion is making the animals even more aggressive.
Whack it. Righto, let's get up, boys. All hands on. 1, 2, 3. Okay, Mike, let's jump. Blindfold. Guys.
You got him?
Whoop, he's turning. He's not as big as Stonker, but he's bigger than Mr. Skinny. He needs a name. Malcolm in the middle.
Malcolm's telltale battle scars confirm he's one of the ringleaders.
This is a minor injury. We've had gators years gone by that have had really serious lacerations from teeth. That's exactly what we're trying to prevent. Okay, we're going to let him go, boys. You right to jump again?
Yeah, ready, Dan.
Right.
He's going.
You hold him. Mike, off.
Right.
That's it, mate. Jeez, he took off. You right? That's Brutus. Heading away from us there. He's actually chasing that other gator off.
Tim and the team now have to round up the meanest gator of them all, a repeat offender called Brutus.
Brutus, a few years ago, was sent to the naughty corner.
Straight up.
We had to catch him, take him out and put him in a cooling off pond for spring and summer. That wasn't easy. Reintroduce him in autumn once it had cooled down. See you later. He's a lot bigger than he used to be. He's grown, not in length, but size. Whoa. I know he used to be a cheeky teenager. I'm wondering now if he's the king of this lagoon. Watch out, boys.
So this is his worm tablet as well?
At the Bondi Clinic, companion dog Cujo is getting a thorough health check. It's an anxious time for owner Declan. He suffers cystic fibrosis and is desperate for Chris to give the little pup a clean bill of health.
This health check's very important because Declan goes into hospital every 3 to 4 weeks, and I would really love Cujo to be able to go in with him, and if he can't, it'll be very disappointing for Declan and upsetting to all of us.
What do you reckon? Is he going to scream?
Yep. Last time.
How are you with needles?
He's great.
Better than me?
Give it to Declan instead.
That'd be caring.
Next, Cujo needs a nail trim.
This won't hurt him.
But he isn't enjoying all the attention.
The thing about trimming a dog's nails is you're only removing the very outer edge of the nail, and there's no blood supply to that part, and there's no nerves in there either. So it should be painless. Hey,
It did hurt.
that is a measure of...
What a wuss he is.
Well,
How
hey, they were your words, but I'm taking off the very tip. There's no nerve endings where I'm taking these bits of nail off, so...
You're just spoiled, just showing off.
Cujo, the name in Spanish, means tough and strong.
Cujo, there's nothing wrong.
We'll probably have to rename him.
He's learnt
Bung it on.
that maximum volume gets maximum response. Because I'm holding his paw there. There's nothing more that I'm doing. The fact that Cujo is howling with apparent pain over what should be a painless nail clip tells me that life up until now, it's been pretty good. In fact, it's been as good as it gets. So he's been vaccinated, he's been wormed.
Lovely.
He's had his flea and heartworm treatment.
Lovely.
Okay, so he's had everything done. There's no reason why he can't go into the hospital with you. He looks great.
Which is good.
I feel very happy, so he gets to come in with me, so I don't have to worry about that anymore, and I can focus on getting healthier, I guess.
Chris also wants Cujo to learn who's the boss.
Good news for you, potentially not so great news for Cujo, is that Cujo needs to be enrolled in puppy school.
I think puppy school will be great for Declan and Cujo, for Declan's confidence to be able to go outside, to take him places, do things with him. Their relationship will even be stronger.
Good luck with this one. All right.
Thank you very much.
You got a good dog there, buddy. I'll see you soon.
Thank you. Bye.
Thank you.
Bye.
Got him? All right, let's...
At the Australian Reptile Park, just seconds after the team finally managed to trap Brutus, the biggest and baddest boy of them all, he escapes.
Plan B is to head out in the boat. Let's go fishing. They're hanging around the edges where it's shallow enough that we believe we can get a noose underwater and around the gator's head. Then we throw the rope into our mates, hold on for dear life, and get him ashore. Here he is.
Rather than the moon.
Hold on, back pedal. That's him.
Oh, we got him. Whee! Oh.
Okay, go. We've hooked one. I think it's Brutus, can't be sure. He's given us an awful fight. All I can think about is get the rope to Mike. He's all yours, mate. Let's get in. Righto, hang on, we're coming. One, two. Okay, that'll do. Biggest by far, hey? We're dealing with a serious gator here. Everyone on.
Brutus clearly isn't impressed with Tim's artwork.
I've made a bit of a mess down here, boys. This fella's been marked everywhere. Righto, he's done. Right, 1, 2, 3. There you go.
Not a bad day at the office.
Today was a success. Over the next days and weeks, we'll begin to watch them and build up a catalogue, some data that identifies who the troublemakers are, who the dominant gator is, who's being picked on, who's picking on others. We can then intervene and choose to remove an alligator and put them in a cooling-off pond.
Hi, Coco.
It's now been 5 days since little cat Coco was rushed into Sash after a shocking dog attack.
Let's get you out. That's a girl. Hi, honey.
Coco was viciously mauled by a dog. She had surgery, had a bit of a rocky recovery, and now it's time for her drains to come out.
All right, now this is going to feel a little bit funny. Ready, Coco? We'll just do it quick. Done. Good girl. You didn't even notice.
But Lisa won't be able to relax until Coco starts to show some interest in food.
No more of this hunger strike.
We're offering her different things, but she just turns her nose up at it. I'm going to try again today and see how she goes.
Hey, Coco, you want to try some of this?
I take Coco's favourite food off the shelf, I warm it up, I prepare it nicely, and I put the bowl in front of her face.
Oh, it's pretty good. That's a good girl. Look at you.
Wow.
Hey, that's so good.
She's ravenous.
Within a matter of seconds, she just lays into it. And I am smiling a lot because this means that she is almost ready to go home.
You're gonna have some more wounds, but at least you've made it through, huh? You're pretty good.
You're gonna have fun, Cujo. You're gonna do what you're told.
Declan and Cujo are back at the Bondi Clinic for school.
There we go.
Puppy school.
Hi guys, hi Declan. How's Cujo?
He's good.
He's been good. Come and take a seat. I'll just close the door and we'll get started.
I think Chris thought the puppy school would be good for Cujo because he's kind of spoiled and does whatever he wants, really.
Cujo, there's nothing wrong.
When Chris first met cystic fibrosis sufferer Declan and his new cavoodle, he quickly worked out that Cujo was already a handful.
He's learned that maximum volume gets maximum response. Because I'm holding his paw there. There's nothing more that I'm doing.
Chris prescribed immediate enrolment in puppy school.
So this is how your pup's going to learn how to interact with other people.
Head vet nurse Neil is in charge.
So by the end of the course, we're going to have happy socialised dogs. They're going to be happy meeting other people as well as meeting other dogs. If we get them to learn these things now, it means we're plain sailing for the rest of the dog's life.
It's essential that precocious pup Cujo learn some manners because he'll be accompanying Declan on his many hospital visits.
One of the most important responses is getting your dog to make sure that it knows its name and to come back to you.
Bonnie, come.
Good girl. We want to make sure that they're safe and they're listening to us. And that could be something that saves your puppy's life. Get really excited. Come. This way. Come on. Maybe Mum can help a little bit. That's it. Good girl. So call his name and then get him to come really excited.
Cujo, come. Cujo, come.
That's it. Good boy. When you're at home practicing, that excitement will get him to come to you, OK?
I knew that Cujo would be good for him because he does do what he's asked at home, but sometimes he mucks up, so I'm glad he did it well for him today in front of witnesses, so Declan was still happy.
Cujo, sit.
Good boy. Very good. So we've had a really good first class. Thank you for coming along and spending a bit of time. You guys are going to do a great job, I can tell already. So with Declan and Cujo, that bond is going to be so important for both of them. They're going to be best friends. They're going to go everywhere, do everything together. Thanks, guys. Keep up the good work. You're doing really well there, Declan. Very impressed. I can see this amazing relationship happening for both of them there.
Went very well. Very proud of him.
We love you. Coco. Hi, darling. It's time to go home. Hey? Good girl. You want to hop in here? Hey, you're a good girl.
At Sash, it's good news for dog bite victim Coco.
Coco is looking fantastic today. She's eating well, she's bright, she's happy, she's comfortable, and finally she is ready to go home.
Owners Tracy and Vance are relieved their little girl's ordeal is finally over.
I've prepared a little room for her at home. Everything's ready for her and we just want to take her home now and look after her.
That's a girl. They're going to be very happy to see you. Yes, they are. Let's go. Hello.
Yeah, there she is.
Look who's here.
Coco. Hello, Cokes.
Oh, good girl. Gee, she looks fantastic.
There we go. There we go.
Coco. Oh, you like that?
When I brought Coco out to see Vance and Tracy, the smiles on their faces. At one point, they didn't even know if she was going to make it, and now she's in their arms again, purring and as happy as can be. And now she's just going to have to turn some heads with that new haircut.
Coco's so lucky, and we're lucky to have her. I can't believe that we're leaving with her today.
Thank
you so much.
No
Thank
problem.
you. Thanks for looking
No
after her.
problem.
Thank you. Thank you.
She's in good hands at home, I know that. And indoors only now, please.
Oh, absolutely.
Treating Coco's been a little bit of a roller coaster. She wasn't looking good at all. And now, finally, she's going home, and that makes me one very happy vet.
Oh, hi, how are you? We've just found this kitten in the park and we were told to bring him up here.
You just found the kitten?
Yeah, we found him in the park.
Do you want to have a look at it for you?
Yeah, sure, no problem. Got it? Yep.
Good Samaritans Yvonne and her sons Luca and William have rushed into the Bondi clinic with a tiny abandoned kitten.
So you just found this kitten?
Yeah, it was just near the playground, in the box with its toys.
It's a really hot day outside, so for this kitten to be alone and inside this box in the heat really worries me.
It looked like she'd been there for a little while. She looked like she'd been sitting in the sun, so she looked a bit tired and snoozy.
Wow, she's only a baby. I mean, she'd only be a couple of months old, if that.
Yeah.
So it's not really the time to be left alone.
No, not at all, not at all. She's very lucky that one of the kids actually was inquisitive enough to have a look in the box. It looked lethargic and it looked like it had been in the sun for a while. It was very hot and it looked very young, so I was worried that if it was left in the sun for much longer, it might not survive.
I think you've probably arrived just in the nick of time that when you have a kitten that's this small, their whole body is operating on such a high level that it needs water really regularly, it needs food really regularly.
Yeah.
And if it goes without for more than a few hours in heat...
Yeah, and it was very hot. So
then they can dehydrate very quickly and you can lose a kitten like this in direct sun in just an hour or so.
Yeah.
Even less.
You were lucky. Yeah, I know.
If this little girl does have heat stroke, we are going to have to act pretty quickly because her body temperature could skyrocket to a dangerous level where her organs essentially start cooking themselves.
Hello, Tim speaking.
Hey Tim, it's Tara from next door. How are ya?
I'm good. How are you?
A bit better. I'm glad you're at work. I was just wondering if you could come and give me a hand. I've got a little friend and I can only see his tail. I'd hate to imagine how big he is.
Should I come over now?
Yeah, that'd be great.
Okay, I'll be there in a minute.
Thanks.
Bye.
Australian Reptile Park General Manager Tim Faulkner is responding to a call from the family that lives next door to the park.
Let him go, Pop.
They're worried about a snake which has wedged itself in a drain pipe.
Dad's got the snake and hopefully he's holding on and Tim will hurry up and come and save us.
What do you got?
I think it could be a python.
Oh, spot on. This is where you found him?
Yeah. It's just his tail was sticking out.
This is going to be a pretty big snake. You can only see the end of him. Well, I can see it's a diamond python. That part's easy. What I can't see is how I'm going to get it out of there. I don't want him to get down the pipe. Not sure where it goes. If it rains, he could drown. Worst case scenario, he'll pop up through the toilet. Who knows?
Get him out, thanks.
OK. I'm going to start, and just one bit at a time. You can't pull too hard because all the little vertebrae in the back, you don't want to hear them crack.
Yep.
So it's just a little bit at a time. Oh. I know right away this is not going to be easy. I can't tell whether his head is hooked around something or if he's just wedging his body in that pipe. Either way, he's not moving.
Wow. I didn't realise they were so strong.
Yep, very strong.
So, since she's been in the park, she hasn't had anything to drink?
No.
Or eat?
No, nothing.
Okay, so you just came straight here?
Yeah.
Yeah.
At the Bondi Clinic, Chris is urgently assessing a tiny kitten, which was found dumped in a cardboard box at a nearby cricket ground.
Her gums are just on the paler side of pink.
Right.
So, you know, that could be due to shock, it could be due to dehydration.
Right, okay.
She's just a little pale.
When rescuer Yvonne and her sons William and Luca found the stray, she was struggling in the heat.
For this kitten to be alone in that box in direct sun, it's got to worry you, because when dehydration and when heat stroke hit, they can be life-threatening. All right, what I'll do, let's just have a little listen. So her heart rate's really high. That's certainly a sign of stress.
Yeah.
And it can be a result of overheating and dehydration.
Yeah.
Chris now needs to check the kitten's temperature.
Okay. All right. It's just on the upper end of normal.
Yeah.
So she's not suffering from heat stroke,
Yep.
which is a really important thing and real positive. But when I put her on all four legs, something else is going on. See, she's not very happy putting that left
No, she's not, is she?
front leg down. Yeah, she may have a problem with that front leg, which may explain why.
Yeah, she was there.
Someone may have decided it was all a bit too much. For her to be holding the leg up, you know the injury is severe. But my concern right now is the trauma may have been so great, it's damaged the nerve in her leg. If she's damaged the nerves, then things are a bit more serious.
Yeah.
Because you often can't fix nerves, but you can fix bones. So the important thing is, when I squeeze her foot, whether she can actually feel it. Just give those toes a bit of a squeeze. Okay, that's good. So we know that she has nerve function going right to her toes.
Yeah.
What we don't know is what's caused her to have that leg hanging the way it is. What we need to do is take an X-ray.
Yep, okay.
And from there, I can tell you exactly what's going on.
Okay.
Hopefully the leg is the only problem that this kitten has. It is one of those situations where you have to stay incredibly positive, because if the X-rays show a really bad fracture and something that just can't be fixed, there is a chance she'll have to lose the leg.
I don't know how I'm going to get him out.
Come on.
Oh, every time I pull and then I relax, he takes back what I've got.
At a family home next to the Australian Reptile Park, Tim is struggling to rescue an obstinate diamond python, which has firmly wedged itself in a drain pipe.
Yeah, we wanted this diamond python moved, hopefully into the bush, so then it can't hurt our chickens, or we've also got dogs too, that we don't want the dogs to, get the snake either. So hopefully we'll get him out and he'll be right.
Come on. You gotta get that snake out.
I'm trying, guys.
Look at it wrapped up around Tim's arm.
I'm struggling. I'm in full sun. My arms are starting to shake. I can see sweat dripping off my nose.
Here, Tim, may as well get comfy.
Hey, thank you. Oh, that's better. My arms are shaky and sore.
Oh, I'm no good.
After more than 10 minutes, Tim is losing the battle to get the trapped snake out.
Really, I might get you to run over to the park.
Yep.
And ask for Billy, please.
Bill.
Yep, and just ask him to come over.
No worries, be back in a
Thank
sec.
you. I'm going to call in reinforcements. The last thing I want is for this snake to slip, and he's gone. I can't get him then, or it's going to be a lot harder. I'm calling Billy. Hey, mate, have a go at him. Grab on. My arms are jelly. Thanks, mate.
Jelly?
They're jelly.
It has a strength in it.
Yep.
Diamond pythons, these things are strong. We've got a serious fight on our hands.
Strong?
Yeah, man.
I got an idea, mate. I think we pour a bit of water down there. It's not going to hurt him.
Yep.
But it might make it slippery. Might give us the advantage.
Sounds good.
You ready for a bit of water?
Yep.
Okay, coming now. So I hit him with the hose and he starts to move. And maybe now we're up to half the snakes out of the pipe. But again, He's locked in.
You want to jump in again?
Yes, no worries. There's a worry if we pull too hard, we could break his back, separate his vertebra. We don't want to do that. Come on.
You ready for this now?
At the Bondi Clinic, Chris is about to x-ray this tiny stray. The abandoned kitten was found in a cardboard box at a local cricket ground and has a badly injured front leg.
Normally you'd use a sedation, but considering we don't know exactly what's caused these injuries, whether she's been hit by a car or had a big fall, the risk of giving her a sedation could actually cause her whole system to crash. So I'm trying to be as gentle as possible. X-ray.
Oh, wow. Yeah, I think we now know why she can't walk on that leg. That's a big fracture.
Whatever's caused that fracture, we're talking about something major, because bones don't break like that every day. Being left alone in a box on a hot day is already horrific, but when you look at these x-rays, you understand just the trauma that this kitten's been through. You realise this has been a bad day of all bad days.
Chris now needs to share the disturbing news with concerned rescuers Yvonne and her sons William and Luca.
This is our problem leg, so it comes down, then all of a sudden it has a break, hasn't it? Yeah, it does. So it's going to take an operation to fix that, which we can do in here.
Yeah, okay.
But the big challenge is the fact she's so young. I mean, looking at her teeth, she's probably about 7 or 8 weeks of age.
Tiny.
So an anaesthetic on these sort of little kittens is always a little risky, but you know, we'll obviously take every precaution with her.
Yeah, sure.
She'll stay with us tonight, and if she's up to it, she'll have the operation in the morning. But we do need to talk about names. And obviously, as the people that found her, you've got to approve this. So what do you reckon? If you look at her face, don't you reckon it looks like she's already wearing her zinc on her nose? And you guys were off on Saturday
Playing cricket.
Yeah. What do you reckon, cricket? What do you think?
Yeah. You approve of that one? Yeah.
All right, well, she's going to go and have a little sleep now, prepare herself for the operation. But thank you. In all seriousness, what you did today was very special, guys.
No problem.
Bye-bye,
So, no worries. Okay. See you later, guys. Bye-bye.
See you later.
Sure, identifying exactly what sort of injuries cricket has is some sort of relief, but cricket only weighs 1 kilogram. She's 8 weeks by our best estimation. That's usually too small and too young to even attempt an operation, but the circumstances say we have to. That operation now presents a whole lot of risks we need to be aware of to make sure, after all we've been through, we now don't lose this little girl.
Come on.
At a home next to the Australian Reptile Park, Tim and keeper Billy are still struggling to remove a diamond python from a drain pipe.
I'll give you a bit of a spray.
Good.
Billy is now putting water down the pipe in the hope of flushing out the stubborn intruder.
This is a diamond python, which they get fairly large, up to 3 metres. I'm guessing that this fella's going to be 2 metres over. Okay, he's moving. Look how big he is, kids. He just keeps coming. He's loosened up and he's coming out. Last bit. Look, he's got a bit of skin off on his neck there. And all of a sudden the head pops out, and there he is. Have a look at him. Do you think he was that big? Yeah. You did? What a battle, but we've got him. Well, that was the hardest python I have ever caught. Diamond pythons must surely be one of the most beautiful pythons in the world. They're only found around the Sydney region and east coast of Australia. Now, this male, he'd be out in search of a female or a feed, but the sun's come up. He needs to find somewhere to hide. He doesn't want to be out and vulnerable. He's found the pipe, picked a bad spot. Can you think of a name for him?
What about Peter the Python?
Peter the Python. OK, Peter the Python it is.
Okay, let him go!
Let's go and let him go. Come with me. Clint takes us to a beautiful spot just off to the side of his property. Beautiful forest, a nice creek, perfect diamond python habitat, and we let him go. Everyone have a quick pat, say see you, Pete.
See you.
There we go. Pete the python is happy now. He's had a stressful day, but he's out now and he's back in his natural habitat. Hey, what are you going to do if you find another snake?
Go to him.
Call me. Don't you catch him. Let's go.
So I'll start to run some anaesthetic in now.
Coco. That's it.
Next morning at the Bondi Clinic, it's time for Chris to start the delicate surgery on little Cricket. The tiny abandoned kitten was found with a badly fractured front leg.
It's a measure of how small she is. Her dose of this anaesthetic is 0.005 of a mil. So I'm having to actually bulk it out with some extra fluid just so we can be fairly accurate when it comes to giving her a dose.
Head vet nurse Neil will be assisting Chris with the operation, keeping a constant watch on the little kitten's vital signs.
I think we're getting a bit sleepy now.
Yeah, we are. Okay, let's go. There's no doubt that anaesthetics for animals this size and this age have a huge amount of risk associated with them, simply because the animals are so young, they're so fragile, they don't have the energy reserves, and really if they lose just a little bit of blood, that makes a huge difference to their circulation. You have to take each and every step so carefully, otherwise, in the blink of an eye, you can lose them.
All right. All good? All right, all good. Let's do it.
It's going to be a risky operation. Chris needs to expose the fracture and then insert a pin to join the two broken bones. It will be incredibly difficult working on such a tiny patient.
There's absolutely no chance to relax here right now. I mean, you look into this area and there are big veins, there are big arteries, and there are big nerves. Hitting any one of them could be catastrophic. The challenge here is that once a fracture occurs, all the muscles tend to tighten over the top almost to provide the strength that the bone's no longer providing. And so there's a lot of work that goes into just working my way through those and exposing the end of the fractured bone. So that sharp point there is actually the very end of the fracture. So we should be looking at the bottom part of the humerus there. Finally, I have some sort of access to the ends of the bone. The idea now is to put the pin up the top fragment.
With the pin inserted into one end of the bone, Chris now needs to find the other shattered end.
So we need to join that bit there to this bit here. Like a lot of kittens, Cricket has very thin bones. She's only been on this earth for about 8 weeks, so she hasn't had much calcium to really strengthen them up. So I know if I push too hard, I could actually crack the bone. If I do that, then this whole operation will be a failure.
At the Bondi Referral Hospital Sash, a young hit-run victim is being rushed into emergency.
She's been taken out the back quite quickly, grabbed from us, which is lovely, but we're quite nervous to know what's going on. We don't know what's happening at this time.
Thank you, sweetie.
Misha's distressed owner frantically searched for 7 hours to find the runaway husky. The 2-year-old was eventually found, left for dead on the side of the road.
Oh no, Pumpkin, it's going to be sore. You're a good baby. Good dog.
We were horrified. You could see her eyes were quite wide and she was in shock.
1, 2, 3. Good dog. Good girl.
Now emergency vet Dr. Vivica Russell is urgently assessing the young husky's injuries.
Misha has quite severe damage to her chest and this is interfering with her breathing.
Owner Diane is desperately waiting for an update on Misha's condition.
There's a lot of things we have to worry about when you think of a little animal being hit by a large vehicle, that at speed probably. I know it's a lot to take in, it's a big shock. I know how you're feeling. I've had my own animal run over and it's very distressing.
Misha is almost certainly going to need surgery, so the trauma team has alerted specialist surgeon Dr. Steve Fernside.
Hey Jade, how's she going?
Doing all right.
You all right? Misha's been badly traumatised, unfortunately. She's got a punctured lung and what appears to be bones moving around in her pelvis. So the most important priority at this stage is to get her stabilised, make sure she can breathe properly, make sure her life is not in danger. Once we've got that established, then we can start to think about how we're going to put back what appears to be a pretty badly broken pelvis.
So she needs to be on this side so we can have some oxygen.
Misha is still having trouble breathing properly, so leaking air has to be removed from around her damaged lungs. Until that's stabilised, she could be facing another 48 hours before she can have surgery.
Good girl. I love you, darling. We'll be back soon.
Okay, we're just starting to see it now. So there it is there, just popping up.
At the Bondi Clinic, the delicate operation to repair little Cricket's badly fractured leg is continuing. Chris has inserted a metal pin into one end of the tiny kitten's fractured leg. He's now attempting to secure it to the other end of the broken bone.
See? I think so. This pin now feels like it has gone into place, but I need to know if it's gone in too far or if it's fallen short. To do that, I need an X-ray.
X-ray!
All right, okay, that's good. So the pin is going right through the middle of the bone. It's bringing the two ends together, and the join is pretty neat.
The X-rays look good. The pin's sitting exactly where I want it to be, so really it's a matter of getting straight back into the surgery because time's ticking. Okay, let's cut this pin. All right, so we pulled that pin back and cut it off, so okay, we're right to close.
Yep.
All right, I'm done there.
The little stray has now been on the operating table for an hour and a half, and Chris is anxious for the tiny kitten to wake up.
I know from my experience that when you're dealing with an animal as small as Cricket is, you can't relax at this stage. We have to keep our eye on the game and make sure that Cricket wakes up from this anaesthetic perfectly.
We've been through so much, don't give up now.
Okay, he's just starting to come around now. We get a bit.
Little Cricket is waking up safely, but it will be another few days before Chris knows if the operation to save her leg has been a success.
We've asked just so much of Cricket today. It's been a marathon operation for such a small kitten, but she's come out the other side and now hopefully we can start looking at a new life for her, a new home.
Next morning at Sash, the anxious wait for extreme bruising around hit-run victim Misha's lungs to ease is over.
Yeah, not too bad, are you, darling?
Now, Specialist Surgeon Dr. Steve Fernside can take over and try to repair her badly shattered pelvis.
Good morning, Misha. Poor little Misha. She's been hit by the car, left by the side of the road in a hit-and-run attack. She's had a severely punctured lung and badly fractured pelvis. Thankfully, her lungs have stabilised over the last day or so and we can now take her into surgery and fix a broken pelvis. So what we'll do is just be gentle here. Position it there. All right, Misha, let's get you radiographed and get you into surgery. So what Misha's got is a nasty fracture of her pelvis. The pelvis in the dog is structured like a box, and there are sort of hinges or joins up the top end, and then there's a box-like structure. Now what she's done is on the right side, she has taken away that join between her spine and her pelvis, so that's actually pulled apart. And on the left side, she's broken through the middle of the panel of the box. She's basically got a box and instead of being nice and square, is now like that.
Misha's surgery will be long and complicated, but Steve is hoping it will give the young hit-run victim a second chance at life.
We need to realign her pelvis and put some implants in there to hold it all together. Now, unfortunately, right next to where we're operating are two big nerves that supply the innervation to the back legs. If they get injured or damaged as we're realigning all this and putting it back together, then that can be a serious complication that could affect her ability to walk.
Look at you. I did not expect to see you sitting up.
Over at the Bondi Clinic, Chris is anxious to check on tiny Cricket.
After going through an operation like Cricket has to repair that fractured leg, you appreciate that she's been through a lot. So it's important now to see how she's going.
Well, she's putting on the big performance today. She's looking for affection. She's obviously feeling more comfortable in that leg because the bones aren't moving around anymore. She's happy to stand on it, so this is good.
It's the best possible outcome to already, just 12 hours after the operation, have her willing to actually put some weight on it. That's far beyond my expectations.
She's really only been away from her mum and her other kitten litter mates for, it could only be a few days, so it's a lot to ask of a little girl like this, but she just seems to take every little challenge and meet it head on and give it that right hook.
Chris is so impressed with the courageous kitten's progress that he's decided the little orphan is allowed a special treat.
Normally after major surgery, you really limit how many visitors a patient has. You don't want them up, about and excited. In Cricket's case though, we're going to make an exception. Tomorrow, she might just see some familiar faces.
Alrighty, so poor Misha, we're just going to get her positioned for surgery now. You can actually see that her pelvis is slightly misshapen here on the surface now that we've clipped all her hair away. This side is sitting too high up. You can see how that box has moved like that, and her pelvis is misshapen. So we're going to realign that, put it back into the right position.
At Sash, the complex surgery to repair hit-run victim Misha's pelvis is underway. It will be in 2 stages, with Steve starting on her dislocated right side first.
First thing we're doing is dissecting down onto the wing of her ilium, which is part of her pelvis. And this is the part that's dislocated from the spine. So this is the part we've got to bring back into alignment and reconnect. Poor Misha, I mean, to be left by the side of the road with these horrible pelvic injuries is just awful to even think about for this poor dog. So we've got a tough couple of hours ahead trying to put this all back together.
Steve will be operating dangerously close to the important sciatic nerve at the base of Misha's spine.
So if we hit the nerve, it causes damage to the main nerve supply to the back leg. So that's pretty serious. We've got to be careful because that affects her ability to walk. All right, let's try that. So we've just put our first pin in, and this is where we're reattaching the joint from the sacrum at the base of the spine to the pelvis. We've got about less than a square centimetre of bone to get this into the right position, so we have to be very precise about where we're putting this pin. Hard work, that's for sure. Okay, it seems to be reducing now. That was hard, but the screw's in a really good position. I'm very pleased with the way things are going. We're halfway there. We've got to roll her over now and do the other side, which is going to be equally as challenging in a slightly different way. But I'm pleased with that, but still a long way to go. This battle's a long way from over. It's like a jigsaw puzzle where the pieces just don't fit. So we're going to need to try very hard to put this all back together in the way that nature intended it to be. Righto. This bone has been pretty badly damaged and it's pushed way out of position, so it's going to take a bit of grunt work to get it back in the right spot. Misha's quite a strong dog. Her muscles are trying to pull this bone in the wrong direction. It's been out for a couple of days, and now we've got to try and get it back. And as you can see, it's not that easy to do. It because the muscles, the tendons, the ligaments, everything around a pelvis is so tight. All right. Okay, suction. What we do is pull it back halfway and then have a bit of a break and let the muscles relax. And then we try and get it the rest of the way. Okay, my dear. We're getting there. We've got it in a pretty good position now.
Finally, with the bones realigned, Steve can now attach a plate to help the pelvis hold its shape.
Okay. It's been a bit of a job, but we've got there. We're happy with the results so far.
It's been a marathon surgery, and Steve is hopeful that Misha will now have full use of both legs.
She was fortunate that she didn't suffer a head injury here, but at the same time she had to have a big surgery. We're very optimistic that this dog is going to go on and live a normal life. You just rest your head there. There you go, sweetheart. You've had a big day, my girl. Good girl.
You've got visitors, Cricket.
Next day at the Bondi Clinic, little Cricket is now well enough for some surprise visitors. Rescuers Yvonne and her boys are keen to see how well the tiny kitten is recovering after her leg operation.
I was a bit worried that she wouldn't be alright in the surgery because she's a small kitten, so hopefully she pulled through okay.
So, would you like a hold?
Oh, yeah, we'll have a hold.
So she's doing all right. I mean, she's making progress.
Yeah.
And that's the important thing. The injury she had, it wasn't small.
Yeah.
And it was actually quite an effort to put it back together, even though we're talking about bones that are, this big. The one thing that I've noticed since the operation, she's not going to go back to using that leg straight away.
No.
And she's going to try to guard that.
Yeah.
She's guarding a little bit more than I'd normally
I was going to say,
expect.
she doesn't look like she's got the paw down at all.
Exactly. So I'm just watching that. I just want to make sure she does get full nerve function back in that foot. For now, the most important thing is just keeping her fairly quiet.
Yeah,
that's why I'm happy for her to be in her little cage there and resting, because her bones are really in a crucial stage where they need to mend. But she's got the right attitude with it all, and she's affectionate and she's getting plenty of attention in here. And,
really? I can't imagine that she's not demanding that. Hey?
Exactly. You look at those boys' faces, they're infatuated by her and clearly thinking about how they convince Mum to take Cricket home.
It's a big step from rescuer to owner, and Yvonne isn't taking it lightly.
I mean, it wasn't a plan to have a kitten, but you never know, we might take her, but you do really need to make a decision if you're going to have a pet, that you're going to keep it forever.
Okay, well, we'll put her back in here. The fact is, whether Yvonne and the boys decide to take Cricket home in the end, it doesn't really matter. Ultimately, they've already saved her life, and that's the really important thing to remember right now. All right. So, thank you for calling by. It is very, very sweet of you, so I'm sure she appreciates it.
Nice to see her, isn't it, Luca?
Yep.
Bye-bye, Cricket. She's giving me a handshake. Look at that. She's got a handshake.
All right, guys.
Great.
Thanks for calling by.
Thanks, Chris.
We'll see you soon.
I'll see you later.
Okay. Cricket doesn't really seem to know the meaning of rest and of taking it easy, but that is exactly what she needs to do right now. We want to see that movement return to that leg and get her more comfortable in using it. If she can do that over the next few weeks, then we can seriously look at her going to a new home, wherever that is.
Hi, Mish. Ready to go home? You are looking great, my girl, aren't you?
It's a big day for hit-run victim Misha. 4 days ago, the young Husky was rushed into Sash with a smashed pelvis.
She's basically got a box and instead of being nice and square, is now like that.
Her injuries were so bad, it was feared she wouldn't be able to walk normally again.
Hard work, that's for sure. Seems to be reducing now.
Against all odds, the 2-year-old Husky is making an amazing recovery.
Good girl. Just gently. Misha's doing great. She's doing really well. I'm really pleased with the way she's recovered. Look, within less than a week, she's walking around. She doesn't have any of those nerve deficits we were worried about. She's comfortable. She looks terrific. So she's going home to Mum, and I think Mum will be wrapped.
Oh, just over the moon. Everyone's waiting for the call to bring her home, so we've got a special place made up for a nice bed, nice crate, everything for safe for her. So yes, we're all very excited to see her and bring her home with us.
Hello, Diane. How are you?
Good, thank you.
Is your baby back?
Hi, gorgeous.
She's doing great.
Hi.
Better than I expected, actually. She's really doing very well.
Oh, she
very
looks
happy with
great.
her.
Oh, baby, you look great.
She'll need to be kept quiet for the next 4 to 6 weeks while
Yeah.
this pelvis heals. But you know, at this stage, her progress is really excellent, and she's recovered very well.
Yeah.
Very pleased with her.
Well, she looks a lot happier this time.
She's a lot happier than she was a few days ago, that's for
Yeah.
sure. See you later, Mish. You be good at home. Don't give your mum too much trouble, all right? And look after that pelvis.
Yeah, thank you very much.
You're welcome.
Thank you.
She's going home to a great family, very supportive. She's going to need to be. It's going to be tough for that first couple of weeks keeping her quiet, but I hope everything goes well from there.
Come on, this way. Good girl.
Excuse me. What is it? What's with buttons? That can't last.
It's been 4 weeks since the surgery to repair Cricket's left front leg.
Normally, if you want to check if the leg's working, you stretch it, you might take some x-rays here. We just check if she can pull up buttons and make phone calls. I know it's all about pulling your weight, but we don't need a secretary. You are just proving that you cannot stay around here much longer, and you are going to have to go to your new home. Yep. And you better not behave like that. So Yvonne has decided not to adopt little Cricket. I mean, obviously, the whole family's played such a huge role in her life and ultimately her survival, but for them, the timing just wasn't right, and the worst thing you can do is force a pet into a family that's not ready for one. The good news, though, is that we do actually have another person who is very keen to adopt her.
You'll be ready to get out of here, I'm sure. She's just full of beans all the time.
Yeah.
This leg's amazing. You've done a great job.
She uses it for good as well as evil. Yeah. Whilst Neil is a real softie, he's a hard man when it comes to making sure that his kittens go to the right homes. He has a little checklist he always likes to run through, and if he doesn't think the owner's suitable, he'll say no.
So you think they're a suitable owner for a cat?
Definitely, yeah. They've had cats before.
They've had cats before?
Yeah.
Have they had any other pets before?
Yeah, they've had dogs as well.
Dogs?
Actually, quite a few different types of animals.
OK. Yep, you can have a look when I've finished. Now, are they going to be responsible? So there's a few really important things. Obviously, they're going to have to make sure that she's fed, watered, litter trays looked after, they're in a safe environment.
I trust them.
Yeah.
They're pretty good.
OK.
Yeah. But I think you'll like them, and I think you'll learn to understand why they're pretty trustworthy.
OK.
So the new owner has been given Neil's conditional approval, so here comes the exciting part. It's time for Cricket to go home to the new owner for the first time. Kiss, kiss. Lovely. One more.
Thank you. All right, bye-bye. Be good.
Cricket, just trust me on this. You are going to love where we're going. Bit of faith.
Lucky Cricket is getting some VIP treatment, with Chris taking time out to personally deliver her to her new home.
So welcome to your new home. It's actually our home. Oh yeah, we're doing this. It's been kind of a funny situation because I truly did want Yvonne and the kids to adopt Cricket, but each and every time I found I was trying to convince them into taking her, I was giving reasons as to why I should ultimately adopt her. And so when they said no, it wasn't going to work out, I wasn't that disappointed. Are you going to get to love this place? There is so much here for you to look at, for you to get to know, and for those claws of yours to sink themselves in. You already can't wait, can you? Look at you. Cricket? No. What are you scratching? Really, my whole life I've had cats, apart from the last couple of years since I lost my cat, George. George certainly had a unique personality. George, that's not a welcome. And you can never replace that kind of character. So all the while since I lost him, I've been looking for a cat that might go close. And I think Cricket might just be that cat. I wouldn't do that, Cricket. Feel good? That's not gonna happen. You don't have to scratch every single item of furniture in the first 5 minutes you're here. At the moment, I'm looking around my house, trying to appreciate how my house looks now, because it'll never look better. Cricket clearly thinks my house is delicious, and she's willing to scratch and taste every single part of it. You relax? Yeah? Do you know how to relax? Cricket's had just about the hardest start to life that a cat can have. Been abandoned with a broken leg, having to face major surgery and a really long recovery. But hopefully today is a really nice way to start the rest of her life. We're gonna have some fun.